just because your quads are tender, and you find tenderness when you foam roll, doesn't mean you're doing anything productive. What's probably happening is your TFL and your anterior gluteal fibers are sending pain into your quads, and that's getting your quads in trouble. And you can foam roll that every single day and it never really changes. It always comes back. So if that's what's happening, you're going to want to focus more on these gluteal fibers and on the QL. So this is, anatomically, this is adduction. Now people think they call this stretching their IT band. It is not stretching the IT band. You cannot stretch the IT band any more than you can or would want to stretch a ligament. If you stretch a ligament in your ankle or your knee, that's a problem. That's called an injury. That's something then that will make your joint unstable. So what we're actually stretching are these fibers, the TFL fibers, anterior gluteal fibers, posterior gluteal fibers. The whole idea of iliotibial band friction syndrome, this is really a theory that was proposed in sports medicine and athletics. The idea being that the iliotibial band rubs on underlying structures and then creates friction and inflammation. Well, the problem is it's fascially invested into everything underneath it. So that shifting motion is actually completely impossible. It just can't move like that. So the idea that there's friction is out. The idea of stretching your IT band, first of all, is physiologically impossible. So there was a study done. The authors estimate that it would take 2,000 pounds of pressure to actually be able to stretch the fascial material of your IT band. Now, that's a lot of pressure. That's probably like an industrial press of some kind, and you'd be screaming. So, not something you'd even want to do if you could do. But this is kind of like the steel-belted radial material in your tires, It's something that's there for structure. It is not stretchable. Connective tissue like that is not stretchable. Muscles are stretchable. Sarcomeres have elastic properties, and muscles are made to contract and to lengthen. Ligaments and tendons, which is basically what we're talking about with the IT band, are not made to, they have about 4% elasticity, which means that, if you stretch it, it's kind of going to stay stretched. When you yank your ligaments and you sprain your ankle, that's not a good thing, because that's not going to contract again. So the idea of stretching your IT band is physiologically just absurd. One of the things that I want to make you aware of, I do trigger point therapy. That's something that some people know a little bit about, but generally it's kind of a lost art. And we talk about pain referral. So pain referral means that you have a problem in a muscle, let's say in your hip, but where you feel the pain is running down your leg. So one of your gluteal muscles, glute minimus, actually can send pain down the leg, can create symptoms that definitely would be felt in the same areas as so-called IT band pain. As I come across, you tell me what you're feeling.
I can feel it already.
And where do you feel it?
Part of the leg, even laterals, about only a few inches above the knee, it stops.
Okay, so Will is already feeling pain down the lateral leg. Now, that's not because of his IT band, that's probably because of his TFL and his glute minimus. So this just tells you right away. Now, I'm not just going to keep stretching that. It wouldn't be productive. So what we always want to do is we want to put some compression and vibration on those muscles. So very easy. And then I'm just going to let that leg come through. What are you feeling now?
Nothing.
So at this point, actually more like here, when we started, he was feeling lateral leg pain, IT band pain. IT band pain is now gone. So that's what I mean. This stuff works really quickly, and he's got a whole lot more adduction.
Still don't even.
Still good?
No tension at all.
Wow, look at that. That's crazy.